everyone. Do you or someone you know suffer from chronic low back pain? Well, much of the current research shows that chronic low back pain can be associated with altered motor control of the trunk muscles. However, the best exercise for this altered motor control is still very unclear. Exercise in general is typically the first recommendation for nonspecific treatment for low back pain, but there's still not conclusive evidence as to what type of exercise is the best for low back pain treatment. Previous research has also shown that patients with low back pain have a delayed anticipatory postural control period during rapid limb movement. This means that patients with low back pain were delayed in making adjustments to their posture when their arms and legs were moved rapidly while doing movements or exercises such as jumping or running. APA, or anticipated postural adjustments, are important for individuals in order to re-stabilize after a disruption in their stability or balance. The trunk is primarily responsible for helping us to re-stabilize, so exercises to improve trunk stability are theoretically the best for improving chronic low back pain. Although research is so limited, a study by Brooks and colleagues done in 2012 aimed at determining if specific or nonspecific trunk exercises were effective in improving low back pain patients' self-rated disability, pain, and activation of these trunk muscles after 8 weeks. The methodology they used in their study will be discussed next.
This study was a randomized controlled trial that lasted 8 weeks. 64 patients with chronic low back pain were randomly assigned to a specific trunk exercise group that performed Pilates training and a general exercise group that performed indoor stationary cycle training. All participants were required to go to class 3 times a week for 8 weeks total. All sessions were 50 to 60 minutes, with all of these sessions being supervised with a 10-to-1 participant to instructor ratio. The inclusion criteria composed of men and women aged between 18 and 50 years that had ongoing recurrent lower back pain that lasted greater than 12 weeks. The exclusion criteria was the presence of severe postural abnormality, pain radiating below the knee, known lumbar disc hernia or fracture, history of back surgery, and other factors. The control for expectation bias was that participants were blinded to the use of modalities by being informed they were volunteering for an exercise trial to investigate how exercise programs work for people with chronic lower back pain. In terms of data collection, self-rated disability and pain scores were collected before and after training period. Also, electromyographic activity of various trunk muscles were recorded during performance of a rapid shoulder flexion test before and after the training period. In addition, muscle onsets were calculated. And lastly, latency time, measured in meters per second, were calculated between onset of each trunk muscle and anterior deltoid, which ultimately formed the basis of motor control analysis.
To go over the results of the study with y'all. So at the start of the study, the researchers had the participants of both groups take a couple of tests. The researchers wanted to see a couple things. They wanted to see how well the participants could handle or function with their low back pain, how bad they felt like their low back pain was, and how early they fired their low back muscles in response to postural changes. And the postural change that the researchers used in this study was shoulder flexion, or raising an arm. After the 8-week training period, the researchers had all the participants retake the very same tests in order to get a before and after training comparison. The researchers saw that those in the specific exercise group, or the Pilates group, scored a lot better in self-rated tests for pain and disability when compared to the general exercise group. The researchers also saw that regardless of the group they were in, participants improved in muscle onset timing. This meant that participants were firing off their trunk muscles a lot later than they did at the start of the study, whenever they would flex their shoulders.
So I would like to elaborate on the results of the findings. So within this research, there seemed to be a decrease in both self-disability scores and self-pain scores within both groups. But the specific trunk exercise group seen a more drastic and more meaningful decrease in scores. It is also worth noting that the anticipatory postural alignment did not change within the 8 weeks of this trial. This further supports the research that we need to start incorporating specific trunk exercises to treat individuals who have low back pain. The findings were similar to observed patterns found within asymmetric trunk muscles that were analyzed using Doppler imaging. The research also shows that the drawing in technique targets abdominal muscles as well as lumbar muscles. Although there was no change within the anticipatory postural alignment, evidence suggests that the drawing in technique is not mandatory for trunk-specific exercises. In regards to validity, the research did not analyze subgroups or the responsiveness of training, which can ultimately improve the design of the programs. By doing so, they can contribute to the formation of specific exercises that can be very effective in decreasing disabilities.
If you are watching this video and you have been suffering from chronic lower back pain, we highly recommend you to do some Pilates exercises. Researchers in this article also refer to Pilates exercise to design the specific trunk exercise in their clinical trial. Pilates exercise will strengthen your abdominal muscle and your butt to relieve your low back pain. You may sign up for a Pilates classes, or you can do some simple Pilates exercise at home, such as pelvic curl, single leg lift, and side bends. You can do it while watching TikTok videos or Snapchat with your friends. It won't take you a lot of time to do these exercises. It just takes you 1 hour a day, and after 2 months, you should feel a difference. Why don't you just give it a try? I hope this video helps you. Thank you for watching.